Hello, I am Major Retired André Tivierge, and I am the co-chair of the Ottawa Veterans Task Force, and I'm happy to bring this initiative to you in partnership with the Department of Family Medicine at the University of Ottawa. Veteran service women represent up to 20% of the veteran population and constitute the largest and fastest growing group among that population. Throughout their career, serving women are confronted with several unique environmental and occupational exposures, which can lead to significant challenges that are different than those experienced by their male counterparts. A number of military women releasing or retiring from the Canadian Armed Forces are today still left without specific support programs or care in place. Some of these women leaving the Canadian Armed Forces have had an experience of broken trust with healthcare providers resulting from their symptoms not being taken seriously or by being minimized or misdiagnosed. As a family doctor providing healthcare to a female veteran patient, you will realize that approaching patients in a trauma-aware manner is a best practice. This session will help you understand why so many female veterans are falling between the cracks, as their unique military-related needs are not well understood by civilian healthcare providers, and the veteran support system also does not recognize their unique female sex-specific needs. This session will also address occupational health hazards specific to the life in the military, thus providing you with a realistic outline of potential health conditions and challenges in dealing with these barriers. A realistic understanding of women-specific challenges and how the institution responded to their unique health concerns will be instrumental in determining the best treatment for them. We will also be looking at the research being conducted and realize that there are a number of issues that have remained largely unexplored still in Canada. To further enlighten us on these important issues, we have put together a panel of experts, some of them which have served and are still serving in the military and in operational theaters. Thank you very much and enjoy today's episode.
Welcome to Module 9, where we will be discussing women veterans. My name is Dr. Stephanie Smith, and I will be one of your co-hosts today. My special guest at the beginning here is Shaylee. She is my daughter. I wanted to make sure she was here for this really wonderful podcast. Given that I am a single mom, I had her by IVF, and I've been very fortunate to have great support through the military work that I've been doing. So Shaylee's going to leave us now, but she would like to say hi to all of you. Can you say hi, Shaylee? Some of you may remember me already from Module 8, where we discussed the importance of moral injury and military sexual trauma and having better understanding of those topics. For those that haven't already watched that excellent module, I'll tell you a little bit more about my background. I'm a newly graduated family medicine doctor from the University of Calgary in 2021. I was then posted to Gagetown, New Brunswick, where I worked for a couple of months and then went on to maternity leave. I've really enjoyed my time working with the military over the last 21 years, where I previously worked as a critical care nursing officer, and then, as mentioned, transitioned to medicine. I've been very involved with medical leadership during my time back into medical world, and was working with the Canadian Medical Association Board, the Resident Doctors of Canada Board, and the Canadian Federation of Medical Students as well. I'm currently on the Federation of Medical Women of Canada as their treasurer, and I'm very happy to be continually involved with many medical leadership opportunities. I've additionally done my research for my master's in disaster and emergency management, looking at resiliency training and how we can use the military's road to mental readiness to help prepare healthcare providers for the stresses of the job that we do every day. I'm looking forward today to be working with Dr. Breeck. She will be joining us to be my co-host today. I'm going to hand it over to her now. Thank you, Dr. Breeck.
Thank you, Dr. Smith. I really enjoyed working with you as well on Module 8, but I am even more excited to be co-hosting today with you to talk about women veterans. Co-hosting together with you makes sense because what makes a veteran special is about their time in the military. So to understand women veterans, you really also need to understand military women and what's different about them. As for my introduction, as you know, I am also a longtime member of the Federation of Medical Women of Canada. I graduated medical school from Memorial University of Newfoundland in 1990. I worked for 20 years as a regular force medical officer, retiring on my pension in Ottawa in 2009. While I was serving, I had the chance to complete a master's degree at the University of Toronto, focusing on the occupational and environmental health needs unique to military women. So I feel I need to manage our expectations right now because this is a topic I know all of us here today could be talking about for hours. So in our very short time together today, we hope to just share some basic foundational background information, a few practice pearls, and our real goal here is to entice you to read the resources that include excellent research reports from our two guests today. Speaking of our guests, first up is Dr. Maya Eichler. Maya, would you be able to introduce yourself and set the stage for us? We know that Canadian military veterans are made up about roughly 15% women and 85% men, and most of those men being white heterosexual men. Can you explain why that fact is important? How does intersectionality and gender-based analysis become such important concepts to understand in order to understand women veterans? Maya.
Thank you, Stephanie and Karen, for having me today. I'm really pleased to be here. So by way of introduction, I am an associate professor at Mount St. Vincent University in Halifax. I'm also the director of the Center for Social Innovation and Community Engagement in Military Affairs here. And our center really specializes in military and veteran issues with a special focus on sex, gender, and other intersectionalities such as race, indigeneity, and sexuality. So you asked me to set the stage a little bit. And so I would begin by saying that, by historic circumstance and fact, the military as an institution was designed by white men with other white men in mind in terms of the support and care systems. And so we are still living with those legacy biases, and they're, beginning to be identified and addressed today. But we need to sort of keep that historic context in mind, because women have been working in non-traditional military roles, such as the combat arms, only since 1989. Which is when the Canadian Human Rights Tribunal ordered the military to open up all previously male-only military occupations to women. So keeping that in mind, it's been just over 30 years since the very first women came into these non-traditional roles. And there's, in fact, been very little research done to date to really know about, what are the potentially unique impacts on the health and well-being of women in these roles. And so, I and my team, we recently had the opportunity to do a really comprehensive scoping review on exactly that question. What do we know in Canada in terms of the research on service women and women veterans to date? So that will be available to all of our listeners as well. The other thing I would add here is that for a very long time, people had sort of assumed that a one-size-fits-all approach to military and veteran research and care was adequate. But increasingly, these days, as we see that the military population is becoming more diverse, we're beginning to understand that one-size-fits-all approach isn't working for everyone, and it tends to privilege the majority or dominant group. So that is, the 72 to 75% male, overwhelmingly white heterosexual men we're talking about here, to the exclusion of those that are members of the non-dominant groups. And so I think whenever we're looking at veterans as a population, I think veterans are best served by recognizing them as individuals with these various intersectionalities based on sex, gender, race, indigeneity, sexuality. And of course, within the federal government, we've been called upon to really systematically consider intersectionality through tools such as Gender-Based Analysis Plus. So if that term gender-based analysis plus is new to you, I suggest you look it up online, and there's a very good free online course that you can take. It only takes about an hour or two to go through, and it gives you sort of the basics around how to approach care and programming and policy through intersectional sex and gender lens. And in addition to women, of course, there's other employment equity groups that we need to consider in relation to the federal government, and including the Canadian Armed Forces, which are Indigenous members, visible minorities, 2S LGBTQ+ members, and disabled members. So, each of these equity employment groups really deserve attention of their own. But, I feel like it's important to begin with women and sex and gender as our sort of main lens, because women are the largest and fastest growing group presently within the military and among the veteran population as well. And so, we have about 16 to 20% women veterans within the veteran population, and approximately 0.1% self-identifying trans women as well.
Thank you, Dr. Eichler, for that thoughtful overview on the importance, I think, of looking at each veteran individually, and to recognize some of the limitations of the past research that may be labeled as military research or veteran research, but unless you dig into it, it often has been male-only research. I also thank you for bringing and highlighting the importance of all the different intersectionalities and the different, what is often termed minority groups within the military. So again, just to highlight women, people of color or racialized, Indigenous, people with different sexual orientations and genders as well. So there's many different areas that need to be considered for, is this research appropriate for the person sitting in front of me? Are they from some of these groups, or do I need to dig deeper? You mentioned something I think that's really important, though. Although we haven't had a lot of research in the past, you have been one of the leaders to be doing research in this field. And you mentioned already that one of the attachments that people can go to in support of this module will be a report that you recently published. I was wondering if you might be able to tell us what to you would maybe be like the top 3 things out of your recent report that you think family doctors should know about female veterans.
Yeah, thanks, Karen. So I think it's very clear from the international research that there are sex and gender specific military occupational hazards that have real, long-term life impacts on servicewomen and women veterans. It is also true that these types of issues have remained largely unexplored in the Canadian context. So I would say that it is important for family physicians to consider and screen women veterans for unique operational and occupational exposures linked to their military service. Military women and veterans will present with overlapping but also different health needs than civilian women. Some of the exposures could include traumas, whether physical or mental, toxins, vaccines, medications, conditions from ill-fitting military equipment. Another example could be stress incontinence from the repetitive filling and moving of sandbags. So there's a whole host of unique operational and occupational exposures that need to be considered in relation to women veterans' care. The second thing I would point to is that, physicians really need to also consider, especially for women who are transitioning from military service, that they may not have been able to or willing to access appropriate female sex-specific care prior to release from the military medical system. And women, especially women with a history of trauma, including military sexual trauma, may have had their medical symptoms, especially if sex-specific, not taken seriously, minimized, or misdiagnosed. Another consideration is that women veterans may have an experience of broken trust with healthcare providers. And so they will need to be approached as patients in a trauma-aware manner. The final point I'd make is that in Canada, the veteran support system is still largely based on the false premise that one size fits all, as I mentioned earlier. And so this creates a veteran support system and veteran programs that tend to still assume that the person coming for care is a male veteran who also very likely has a civilian female spouse supporting him. And therefore, military women who are releasing or retiring from the military, they are really left largely still today without female sex-specific supports programs or care in place to, support them through their transition to civilian life. And so the way I always think of it is that women veterans really tend to fall between the cracks. So, their unique military-related needs are not well understood often by civilian providers. And at the same time, the veteran support systems that are in place also do not recognize their unique female sex-specific needs. So they really fall between the cracks in those respects.
Thank you so much, Dr. Eichler, for those really important, I think, just foundational insights to some of the systemic issues related to the military and veteran experience. So we've covered some generalities. I'm going to pass now back to Dr. Smith to help us discuss some more specifics.
Thank you, Dr. Breeck and Eichler. That was very impressive information that you've been able to pass on and really highlights the importance of understanding this population, really utilizing appropriate and sensitive language when we're communicating with women veterans, and also really recognizing the challenges and experiences that they've had so that we can connect with them the best that we can. So I think that right now it would be wonderful if we could also consider one of the many sex and gender specific military women concerns that will impact veterans. And that is one of musculoskeletal injuries being the number one reason for military women medically releasing from the military, with mental health being number two. Dr. Adamo, could you introduce yourself and tell us about a bit more of your recent research project with the military and some of the highlights of your findings that family doctors might be interested to know about?
Thank you very much. And thank you, Dr. Breeck and Dr. Smith, for this opportunity to speak about some of our research. So I'll introduce myself. I'm Christy Adamo. I'm a professor at the University of Ottawa in the Faculty of Health Sciences, School of Human Kinetics. My research lab examines an eclectic mix of things from placenta biology to intervention focusing on optimizing women's health, specifically in pregnancy and the reproductive years. So I'm going to speak to you about a project that was funded by an Innovations for Defense Excellence and Security grant, whose focus was to identify specific target areas to address in order to support the CAF to recruit, retain, and reach 25% representation of women by 2026. So this is a goal that has been popularized by the Canadian Armed Forces. So as Stephanie said, recognizing that one of the key reasons for early withdrawal and release from the military is musculoskeletal injury, our project was titled A Multi-Stage Approach to Addressing Sex Disparities in Musculoskeletal Injuries in Military Members. And it included three components. So the first component was an online survey distributed through various channels to members of the Canadian Armed Forces and veterans, an environmental scan and set of focus group trials, and finally a physiological characterization study. So while I don't have time to cover all of the exciting data that my team collected, I will focus on three key pieces. So I'm going to focus on overall what our findings found for musculoskeletal injuries. And then I'm going to talk about pregnancy and postpartum, because the majority of the women in the Canadian Armed Forces are in their childbearing years. And finally, I'm going to talk briefly about other reproductive health factors. So first of all, about overall MSKI. So according to our data, female participants reported significantly more repetitive strain injuries than their male peers. Females perceived a higher impact of these musculoskeletal injuries on their daily activities and on their ongoing military career. The injury location differed by CAF environment. So the Army, Navy, and Air Force had different injury places or injury sources. And we recently published data illustrating that female pilots experienced more repetitive strain injuries than their male peers. And this can be found in the Journal of Military and Veterans Health. With regards to pregnancy and postpartum, parity is a risk factor for musculoskeletal injuries. So when compared to nulliparous peers, Paris females, so those that have had biological children, are 57% more likely to have experienced repetitive strain injury. This information was recently presented. This data was presented at the Canadian Institute for Military and Veteran Health Research Conference by a student of mine who was awarded the Banting Award at this conference. So we're very proud of her work and her representation of our group in this. We know that maintaining an exercise routine is important in pregnancy, and particularly in the Canadian Armed Forces, when physical testing is definitely a requisite for employment. However, 30% of female CAF respondents reported that they stopped training in pregnancy. Of those who continued training, less than 20% engaged in policy-directed modifications to their training, and fewer than 4% in the postpartum period. So this is definitely a target area. Similarly, only 7% received specialized physical training support during their pregnancy and the postpartum period. And from our environmental scan, although this is based on limited data, we know that female service personnel returning to duty following a maternity leave are at the greater risk of injury in their first year postpartum than before pregnancy. And back and neck injuries are among the most common types. It was also noted that there's a lack of resources and knowledge about maternal health issues. So again, a potential target. Finally, I'm going to talk about other reproductive health factors. So we know, as was mentioned earlier by Maya, that pelvic floor disorders or urinary incontinence can be an issue. So we know that pelvic floor disorders, those including urinary leakage or pelvic organ prolapse, are very prevalent in Canadian Armed Forces individuals. 59% experiencing urinary leakage during specific activities that they're doing as part of their role in the CAF. Factors that are associated with these pelvic floor disorders are the year of enrollment, higher BMI, higher parity, and physically demanding occupations. These are all independent predictors. Finally, female CAF members with irregular menstrual cycles or absent periods had an increased likelihood of experiencing repetitive strain injury compared to those who had regular menstrual cycles. So again, these female health characteristics are key in potentially predicting who might be at risk. With regards to our findings thus far, we have a few recommendations that we think might be valuable, not only for family medicine, but individuals who are dealing with females in the Canadian Armed Forces. So we really do believe that there needs to be a greater focus on preventative care to mitigate musculoskeletal injury risk for Canadian Armed Forces members, not only for females, but for males as well. We believe that we need to build and offer primary healthcare providers training and knowledge translation actions and activities that can subsequently improve musculoskeletal injury related education of the Canadian Armed Forces members. We believe for the CAF specific piece that perhaps there needs to be a shift in the physical training culture. And we believe that by adopting a life course perspective and creating customized stage specific policies and programs that are better designed to meet CAF members' individual physical and mental states may work to reduce musculoskeletal risk. And finally, one of our key outcomes or one of the key suggestions that we have is we really do feel that we need to create a task force of key stakeholders, which not only includes female Canadian Armed Forces members who've experienced pregnancy and a diverse number of CAF members, but medical doctors, not only obstetricians and gynecologists, but those who might be dealing with women in the CAF or females in the CAF, exercise physiologists, psychologists, etc., in order to develop strategies to implement practical changes in CAF policies and practices to better support female members and their families. Thank you.
Thank you so much for that information, Dr. Adamo. This is amazing work. And as a competitive athlete in the Canadian Armed Forces, I'm actually very intrigued to learn more about this research and review the material itself. It also really highlights to me the pressures associated with maintaining your fitness while you're on maternity leave, as I am right now, and wanting to make sure you're back to your fitness level when you get back to work. So there certainly is that additional pressure. But also just really highlights to me as a family physician in the military right now, the importance of really connecting with people when they are on maternity leave to make sure they're getting those resources and support. So thank you so much for highlighting this very important work. Given that you did a very large study with over 2,000 applicants or participants, were there any other areas besides musculoskeletal injuries that you noticed would be requiring some more research in the future?
There was a few things that came up in some of our focus group pieces related to perhaps perceptions of females in the military. So in our focus groups, we looked at both males and females, and it was quite clear from some of the outcomes that the males just assumed things like pregnancy were very, very easily overcome. And that because it was a choice that a female had made, therefore they sort of had to suffer the consequences of what might come of that. And, that was sort of eye-opening for us and led us to think that perhaps there needs to be maybe a little bit more sensitivity training, perhaps to some of these areas, and more understanding that this is a natural life course piece, but it should not be career ending, that there are many things that can be done over this period of time. And as you are experiencing right now, you understand that does not have to be an end of career piece, that in fact, there's lots of potential supports and things that can be in place to ensure that the transition back to your regular duties can be accommodated appropriately.
Wow, this is really interesting and neat to hear that some of our male counterparts feel that overcoming pregnancy is not as challenging as it might be. I can attest to the fact that I've competed in military events of 50-kilometer rucksack marching. And I would say that going through labor was actually more challenging than that event itself. So thank you very much for that insight. And I think it's really key here to indicate we're really just scratching the surface. There's amazing literature and material that's been researched here that we highly recommend that all of our listeners go to. I think it's important to recognize that women are not just small men and that we can't necessarily compare the same material in the same way. It's important for us to recognize that there's occupational and environmental exposures that can lead to significant challenges for women more so than men. So we need to consider that when we're assessing our patients. We need more female sex-specific research to really get that evidence-based policies and treatment plans that can help this patient population. Thank you so much for the cohort coming today. Thank you for our wonderful speakers and for my co-host. I think it's really important here that we all want to acknowledge we are trying to do some knowledge translation that will help our civilian counterparts so they can provide the best care possible. Thank you so much for being committed to the support of Canadian women veterans.
And thank you, Dr. Smith. As the veteran here, just to add one last point. I know we've talked a lot about actual military women and military women's experience, and you may wonder how that impacts on veterans. I would like to just highlight, when you see the female veteran, ask about these questions. Ask about their musculoskeletal injuries, their problems with equipment, and also if they have had any issues or concerns with their reproductive health of getting pregnant, staying pregnant, or their experiences during their pregnancy. As per our previous module, where we discussed things like military sexual trauma and moral injury, there is often an entire component of moral injury that is related around some of the women's experiences during their pregnancies. It isn't just the pregnancy, it's how the institution responded to their pregnancy. So hopefully that helps put it in a better perspective to understand some of the unique challenges your women veteran might be coming to you with. And this is just a scratch. Please go to our resources and learn more about us. Thank you to all of our guests and my co-host. Thank you very much for listening today.